Hey everyone, here we are again. Happy Monday. It is May 4th, so that means it's the fourth day of the mouth breathing awareness campaign that I started last year in the month of May. Every day I wanted to post some interesting and helpful information about mouth breathing on social media. And this year I'm kind of mixing it up a bit, and I am featuring one of my awesome MyoMentor graduates to share their stories. So a lot of you guys might not know this, but I do a mentoring program for dentists and hygienists, and a handful of other healthcare professionals have taken it as well. But they all have amazing stories, and they're all super passionate healthcare providers, and that's how they got into looking at myofunctional therapy and airway dentistry and tongue ties. So today I am talking to Dr. Staci Whitman from Portland, Oregon, and she's a pediatric dentist. I'm waiting for her to get on. I don't see you yet, Dr. Staci, but she had some really amazing aha moments in her career and in her personal life with her own kids, and that's kind of what led her down the path of looking at all of these myofunctional things like mouth breathing. So people don't realize that mouth breathing is actually a really big deal. It sounds like kind of a silly thing to care about. Let's see, I still don't see her. We'll see if she can get on. It sounds like such a silly thing, like who cares about mouth breathing? But if you're mouth breathing, then that means that you have potentially a bunch of other things going on too. Maybe you're tongue-tied, you probably have allergies. There she is. All right, I'm gonna let you on, Dr. Staci. Sorry, you guys. Can actually, Staci, can you just type a oh, there we go. Okay, perfect. Yay, I think she's joining. Okay, so here we go. Awesome, there you are.
Hey!
Hi. How's it
Of
going?
course, I feel like my Wi-Fi is slow since we talked about that, but sorry.
Oh, don't worry. It should be fine. I'm
Yeah.
super happy to have you here. So
Thank you. I'm
I will
honored.
kind of introduce you. Yeah, a lot of people probably don't realize that so many dentists have taken my program, and I love that you're the first dentist on here talking about this stuff, because I think our patients don't realize that us dental people don't even necessarily know about the effects of mouth breathing and tongue ties and all these myofunctional symptoms. So I love that you're a pediatric
Absolutely.
dentist and you're looking at this. So that's what I want to have you share your story about today. So
Sure.
go tell
I
me
would
from the
love
beginning.
to.
Yeah, how'd you get into all this, and how did you discover that mouth breathing was such a bad thing for our patients and for your own kids too?
Yeah, definitely. That's a part of it. So it's sort of a convoluted story. I'll try to be concise, but issues, strep throat, mouth breathing. I just didn't know. So fast forward, I'm a dentist, and I went into my pediatric residency, and I had my research project, and I didn't know what to do. And so I got very interested in sleep medicine in children. And so I did a research project where we kind of assessed airway and the whole adenoid facies look and sleep apnea. And so it's just always been a passion of mine. But I didn't know how to incorporate that into my pediatric practice for quite some time until I had kids. And then
Okay.
my own kids, I started really paying a lot more attention to all of these things. Particularly for me, I had a really hard time breastfeeding. And, the struggle went on for many weeks. In hindsight, I definitely think my daughter had a tongue tie, but I didn't even know I didn't know what to look for. I was trained, as many are, to stick your tongue out, cool, you're good. And not knowing there's so many more functions to it. So that piqued my interest. And then
actually, I'll have to kind of just interject here for a second, because the hygienist we had on yesterday, she told her breastfeeding story and the struggles she had. and it's so common, and
Yeah.
people don't realize there's a connection between breastfeeding problems, tongue ties, mouth breathing, palate development, all of these things that are so important. People don't even know. And a lot of us healthcare professionals don't even
Yep.
make connections, you know?
Yeah, definitely. I mean, my thing was, it was just really painful. And I was definitely told what I think many moms still are, just kind of power through it. It will
Normal.
pass, it will get better. Yeah, it's normal. Um, so anyway, and so when I was practicing, I was kind of doing the traditional thing where if there were any airway development issues, I sent kids to the orthodontist around 6 or 7. A lot of times their treatment was delayed till they were even older. And meanwhile, these parents were coming in constantly complaining of behavior, and their children's sleep is poor and they just look exhausted all the time. And so I was just trying to put all these pieces together. And so my practice, I kind of rebranded, and I became a more holistic functional practice. And in that, I really wanted to focus more on airway, but I had to seek out how to do that because I didn't feel like I had the training. So that's when I went to the Breathe Institute, and that's where I met you. And my mind was blown, and it's like all of a sudden all these little pieces to the puzzle came together with Dr. Zaghi. And then I realized, well, I really need to know I need to know all facets of the team, including myofunctional. And so I signed up for your MyoMentor program. And
I
I'm
love
sort of
having you on.
Yeah, I'm doing it with a couple friends who are orthodontists, so that's really cool. But anyway, I'm really trying, I think you've said this, like I want to catch things when they're smoldering, not when they're full-blown fires. And so my whole practice model is prevention, and to find root causes and to address them soon before they become big issues.
As young as possible.
Yeah.
So talk about what you discovered with mouth breathing in your practice, and I think you told me before about the connection that you realized with cavities. I think that's a really big interest for parents.
Yeah, I mean, I was, yeah, I can. Am I choppy?
Okay.
Okay.
A little, but it's okay. I think it's good.
I'm sorry. It was hard because I was having parents fill out this sleep questionnaire, but I didn't know what to do with it. I would send them to an ENT or my orthodontist, but it was still not till they were much older, and I just felt they were missing out on all this important sleep, and just seeing the structural changes, the open mouth, the low tongue posture, narrow face. You can just see they're struggling daily, and parents are complaining too. So I'm starting to incorporate more early intervention, like I mentioned, like myomunchies and potentially ALF appliances, myofunctional therapy. I'm doing frenectomies, but also knowing who to refer to and knowing what that means when I send them. So yeah, but it's been great. I mean, again, I'm going through myofunctional therapy with my daughter right now too. She's doing online sessions, and it's been so neat to just see how much she's changing with everything. Her sleep is better, her speech is better, her swallow pattern. I'm not looking over at her with her mouth open, it's closed more. So I'm sort of using her as a guinea pig too, I guess.
Yeah, that's great. Talk about her symptoms. Like as a dentist and as a mom, what did you notice in your daughter that made you realize that she needed myofunctional therapy?
Yeah, so again, I feel guilty because I didn't know what to look for, and it's one of those things, once you see it, you can't unsee it. But she just had her mouth open all the time. And I look back in old photos, her mouth is open, her tongue is low. And I think after the Breathe Institute in your class, it's just all coming together, but her growth pattern is changing. Like her palate is narrowing. She's becoming more class 3. You know, I have models, dental models of her previously. I mean, she is changing and not in a great direction. So we're working myofunctional. She might need a frenectomy. She might need her tonsils out. But it's really nice that
for what do you think started her mouth breathing? Do you have any idea?
I don't. We introduced she's hooked on these, or was on these cups with a straw. And I do think she's tongue tied also, but I think it's,
that could be the reason.
Yeah, I think it's hard to detect. It's more posterior. So when you take her measurements, it's not super obvious, but I do really think it's there. I'm hoping maybe the myofunctional might get us through it, and it's working beautifully right now. But anyway, you know, I think she just developed this terrible habit also of posturing. And I did notice a change in her after a really bad cold once, that her mouth just kicked open and it never went back again. And I didn't know enough to intervene at that point. No, so now I do.
It is such an interesting conversation to have with healthcare professionals, dentists, hygienists, whatever background we are, dental people. You know, this isn't common knowledge. It's not part of our traditional curriculum. And so I think the people who go down this path, like we go down this path because of personal experiences with our own symptoms, our kids, our significant others, people that we care about, or even just patients that we just keep seeing unresolved problems coming back and trying to like figure out root causes. And you know, it's actually the definite minority of dentists and hygienists that even know about these things, right?
Yeah. And my problem too is just I didn't know what to do early on, you know, because a lot of the orthodontists in my community, you know, they weren't really comfortable seeing kids until their adult teeth were starting to come in. So I'm really just trying to catch the 1-year-olds, the 2-year-olds, the 3-year-olds, and it just offer parental support and education, because I found a lot of parents know there's something wrong with their child's airway or their sleep, but they're just told they'll outgrow it, or it's normal, or kids, you know. And so, you know, that book, Sleep Wrecked Kids, I just love it. I think it really empowers parents to be an advocate for their children too. So it's been great. I mean, I could be a full-time student easily. I feel like I have so much more to learn, but I do feel like
it's a learning adventure. If you had to give parents a message like about, I mean, it can be about mouth breathing or airway, whatever. What would you say to parents who are trying to, or who might not know about these things? What would be your advice?
You broke up right there. If I was going to give them a message about airway, what would I say?
About mouth breathing, airway, what would your advice be for parents who have never heard of this stuff, but maybe their kids have symptoms and they don't even know it's a big deal?
Yeah. Well, I think go with the parent gut, you know, believe in, you know, your child best. And so if you're starting to notice behavioral issues, if things just seem off, really try to find the resource of someone that can listen to you. And I think it's really, that's the hard part, which is why I think it's so beautiful what you're doing in the Breathe Institute. You're really spreading the word, not only to parents, but also to providers. And that's why this month is so amazing, this airway month, because it comes up a lot. I will mention to a parent about how a child's posturing or open mouth, and they're like, oh yeah, we were just told that's normal, or we never knew. They'll grow out of it. But then when you dig deeper and you teach them the long-term concerns, they're very motivated to make changes. So it's just finding that sounding board and that support system. So I really believe in, parents are the best advocate for their children. And, as a provider, I want to listen to the parent because they know their child the best. So, yeah.
I agree. Well, I like how
Don't take no for an answer.
I like how you connected the dots in your own daughter to changes in her jaw and facial development. Most people don't realize that if you have these low postured tongue, open mouth posture, mouth breathing, most people don't realize that that changes growth patterns. Maybe you can just touch on that, and then we can, wrap it up. Oh, your connection. Can you hear me? Did you hear that last part?
Yeah. Is it bad? I think so. Can you hear me?
Yep, I can hear you fine.
Okay. I think I heard you. I don't know. Can you repeat it, Sarah? I just want to make sure I answer you thoroughly.
Yeah, it's okay. I was talking about, it's really interesting how you pointed out in your daughter that you could see changes in her growth from her posturing, her low postured tongue, mouth breathing, that kind of thing. You could see changes. 100%. And people don't realize your face will literally grow differently if your mouth is open versus closed.
Yeah, so the biggest concern one of the easiest things to see is truly your palate doesn't grow to its fullest potential. So, if your tongue is up, as you speak about, up at the spot, up at the palate, that's creating the dental arch that you need for ideal airway. I tell parents the roof of the mouth, the floor of the nose. And so if it's very narrow, you're likely getting less oxygen through, and then the nitric oxide cascade and all of that. But yes, the mandible will tend to grow down and out and just perpetuate that open mouth posture. And then of course you're getting less oxygen through your mouth than you are through your nose. And so that can be detrimental to growth and development and brain development and all of that.
Issues. Yeah, for sure.
Yeah, and it can lead to behavioral issues and hyperactivity and, the ADHD correlation. So it's something to pay attention to, definitely. Yeah.
Big deal. Why we're talking about it, right?
Big deal. Yes. Yeah, but I'm sorry for the bad connection, guys.
That's all right. Well, we can kind of let's wrap it up. Why don't you give a shout out? I know you practice. I said it in the beginning before you got on, but your North Portland Pediatric Dentistry. You are going to be hopefully open for business again soon, right? Do you guys know your opening date in Oregon?
Well, we're doing we're trying to triage patients. So we're opening technically in about 10 days, but open business as usual, I really don't know yet.
Okay.
But yeah, you also do dentistry.
Yeah,
NoPo. They call North Portland NoPo in Portland.
I like that. That's cool. And you have like the cutest website. I mean, your design, everything looks so. Love your website and your Instagram and everything. So you guys should all check her out, follow her. And then you also, you started an online health platform as well for families, right? So like a health coaching platform. Do you want to just talk about that really quick?
Sure, thanks. I recently graduated from the Institute of Integrative Nutrition. And so because of coronavirus shutting down, I thought, well, now is a great time to get that health coaching going, which I always intended to. So we haven't launched yet, but my intention is to help families that can't come physically into my office. And I can't diagnose children virtually, but I can help assist. The plan is to help with like thumb sucking cessation, pacifier elimination. I focus a lot, nutrition. Yeah, I focus a lot at my office about diet, nutrition, and how that's the root cause of a lot of disease too. So that should be up, I hope, in a couple weeks. June 1st is my goal. So, and it's called Happy Health by Dr. Staci.
Yeah, I love it. And I love that I like that holistic approach because really, our breathing and our teeth and nutrition, it affects our whole body. So even though you're a dentist, you're still able to have such an impact on all these other systems. So, you know, I like what you're doing. So,
Thank you,
anything else you
Sarah.
want
I
to say?
love what you're doing.
Thank you. Yeah, I'm just happy that you came on and that you wanted to share all this stuff. I think it's very impactful to have a dentist on here. I know there's a few others who are going to be sharing their stories as well. But you know, between being a pediatric dentist and seeing kids with these issues every day and having issues with your own daughter, and having to work through that on a personal level too, I think, you know, you're doing great things. So keep up the good work.
Oh,
Thank
thanks.
you. And
Thank you,
yeah,
Sarah. Thanks, guys.
all right, we'll
Happy
wrap it up.
Myo
Thanks for
month.
joining. Yeah, thanks everyone.
Okay.
This video
Bye,
the
everyone.
recording will go up on YouTube. So we'll be posting that eventually within the next day or so. So, all right. Thank you so much. Bye.